President Joe Biden is taking time off the campaign trail after testing positive for COVID-19. His doctors say he has mild symptoms and is now in Delaware to self-isolate. It's not clear how long he will be off from campaigning. President Biden has had multiple COVID vaccine booster shots, his most recent last September. So that brings up the question, is it time for another booster? 13 on your side, Elena Holland joins us. And should we be getting another COVID booster, Elena?
Maybe. There's a lot of varying guidelines, including your age and your time of your previous vaccine. But current CDC guidelines say anyone over 12 years old should be getting an updated booster. That's if they've had the Pfizer or Moderna shots prior to September 12th of last year. But that said, 3 weeks ago, the CDC issued a recommendation that everyone over the age of 6 months should get an updated COVID vaccine. That's regardless of previous vaccination status. But here's the thing, that vaccine will not be available until later this year. That recommendation will take effect as soon as the new shots are available. According to Yale University, subvariant strains of Omicron, that's commonly called the flirt strains, if you've heard that around, they make up most of the COVID cases in the U.S. right now. Any updated vaccines would likely target those strains. I spoke with Dr. Natasha Bagdasarian, Michigan's chief medical executive, and she says we're actually seeing an increase in COVID cases in the United States right now, or in the state right now, but the levels don't reach that of, previous surges in 2020, 2021. But there is still a reason most people get booster shots in the fall.
We know that after you get a vaccine or even after you have an infection, your immunity is highest for the few months after that infection or that vaccine. And so if we want to keep you most protected over the winter season, it's important to get the booster timed just right. So we usually tell people to get flu vaccines in October, and I would say the same is generally correct for COVID-19 vaccines as well.
Dr. Bagdasarian also said the upcoming booster shot will target the most recent strain, boosting our immunity even more.
So what about older Americans, older people like the president at 81?
Yeah, so the recommendation is for people over the age of 65 to get one of their boosters 4 months after their previous one. So in theory, every 4 months. But there are, again, a lot of factors like if you're immunocompromised, your age, when you've had the last vaccine. So bottom line, just talk to your primary care doctor.
All right. Thank you for that latest information, Elena.